Yeah, my name is Mary Moore. I'm going to talk today about low-level laser therapy and acupuncture and its role in injury rehabilitation. This is kind of based on my clinical experience over the last number of years, and I touch on a lot of what actually has been mentioned before by David when it comes to manipulations, and about medial tibial stress syndrome from Nick and from Ian. So there might be a little bit of overlap, but hopefully I'm going to bring a little bit, more together, and that you'll enjoy it. So, first slide. So, I'm surprised to think that I'd be using a quote from Conor McGregor in conversation or on a slide in a presentation, but his words ring true to me because he is really outlining the fact that, no two injuries are the same, and that the road to recovery is difficult. And it's, of course, difficult for the athlete or for an individual because they rely on us, the clinician, to be able to establish what the mechanism of injury is, to diagnose the problem, to then introduce a rehabilitation program which will hopefully strengthen and condition, maybe to use orthotics if we think if it's appropriate, and of course all this to reduce pain and get their function back. So yeah, easy, right? Not always, of course, but for us, the clinician, it's also a mission of discovery for us to challenge ourselves. Are we treating patients as well as we could be doing? And also maybe to question, is the answer always orthotics as the first line, or should we consider other therapies first? So next slide, please. So I suppose what's common to us all, regardless of where we work, whether we're in the HSC, whether we're in NHS or private practice or specialised sports medicine centres, or even if our cohort of patients are elite athletes, GAA players, quick respect to Dublin, who won men's senior football All-Ireland final, and the ladies, so well done to them. But yeah, so if it's GAA players or weekend warriors, or regardless of just, it could be your average person who's an active person but has degenerative wear and tear, those people are our patients. What's common to us all with them is that more often they have pain and dysfunction. So as podiatrists, our philosophy often to mechanical injury through mechanical injury rehab is with custom orthotics. So we all know the advantages, but do we consider the limitations? So over the years, I have seen in my own clinic where I've thought I've done a really good casting for custom orthotics, really happy with the prescription, fits the individual really well, but they're intolerant to it. And I'm like, okay, why could that be? Or their pain is not reduced. Or often, during video gate analysis or just observing them walking up and down the corridor, I can see, yes, that orthotic, lovely at the foot, but all the proximal stability hasn't been taken into account, and their kinematics are applying a lot of either valgus or varus forces through the foot, and it's not dealing with the full pain. So so how can we do things? How can I myself was asking the question, how can I do things better? Do I need to refer on? Can I make these people stronger, or what can I do? So next slide, please. So some of you might be familiar with this video clip. So just like this famous Tacoma Bridge collapse, we also vibrate. So the body is a vibrating system. So our muscles and joints mechanically adapt to dampen the input signal during locomotion. So to ensure we don't end up like the collapsed bridge, we have mechanisms in place to dampen vibrations to ensure that the input signal is different, so we don't display resonance like what happened here, and so that we can filter the vibrations, and therefore when we're strong, hopefully prevent injury. So thankfully, strong muscles and strong connective tissue can do this because of its viscoelastic nature. However, muscles that are fatigued or weak or damaged are not capable of doing this, and so a risk of, or harder to rehabilitate. Next slide, please. So during the summer, I was at another biomechanics conference, and at that conference, the eminent Ben O'Nig spoke, and that last bit of information, of course, is from his muscle tuning paradigm, and he also, of course, his other famous and well-known paradigm is about the preferred movement pathway, which it's kind of an evolution of muscle tuning, and I really do respect what he's doing, but more often not, of course, in his research and across a lot of the research literature, the participants are always healthy individuals, and of course in my clinic I don't tend to see healthy people with no problems, otherwise why would they be going to me? So I would often question them myself. Those preferred movement pathways are ideals, but what about the deconditioned people, the people who have issues with their muscle firing, where the connective tissue has become really immobile or degenerative or maladaptive? What can we do for them? And this is where I think, and I have found that using acupuncture and low-level laser, it's hard to say, low-level laser is helpful. Next slide, please. So I was introduced to acupuncture first through a CPD courses that were held in NUI Galway, which is where in Ireland you can study podiatry. And I was interested in manual therapies and in exploring, as I say, different options other than orthotics being the first line. So I had an open mind. I didn't really know much about acupuncture. Apart from acupuncturists often look at people's tongues and eyes, and they have a different protocol and assessment. And what I found engaging when I did this course was that from a podiatric perspective, we don't have to fully take on the full classical acupuncture perspective or history. So it's both, it's cheating, but we can just use the bits that we like that's relevant to, in this case, injury rehabilitation or musculoskeletal injuries. And that whole area of acupuncture is called like Western medical acupuncture. What I found, and when I think about what acupuncture does and low-level laser therapy, what it does for me is that it gives you a window, a therapeutic window to make change. So Nick earlier on spoke about exercise therapy and the unloading phase and the goal to introduce strength exercises. But I have found that in some cases, like simple calf raises, they're intolerant to them. So I really wanted to find a way, and was glad to see that using acupuncture and using the stimulation of a needle, that we could increase the compliance, the connective tissue, the actual mechanical compliance of the tissue, reduce the tension, reduce the resistance of the tissue, so temporarily increase the muscle or the ligament or the area to its normal resting length, so that then you could engage in further therapies of strengthening or even maybe better compliance with an orthotic. So the broad mechanism of action for acupuncture is that it increases blood flow, local to the point of insertion. It releases peptides. As I mentioned, it increases tissue compliance, and it reduces the guarding of the muscles. Next slide, please. So in this slide, I'm just demonstrating the few elements that are easy for podiatrists. These skills are, it's a very practical skill over time, and with, like everything, with use, you get more refined, get more elegant with it. So I might just need a pointer, please. Oh, thank you. So the needles, anyway, that are, if you can see them from there, that are not that deeply, that are less deeply inserted, are all needles that are along meridians, which is kind of like a roadmap for where you want to put local points to have, in my eyes, a local effect. There will be, other CNS effects as well, which is, from our perspective, the evidence base is maybe not that rigorous, but definitely patients will report, numbness, they will report ease when those particular points are used. These are called the Beifeng points. They're generally used for arthritis or reducing inflammation and an analgesic effect. So then this one here, which is in deeper, that one there. So that was, I suppose, an example of active needling. So that needle is about 40 millimeters. And so what I'm doing with that is I'm going in towards the interossei, and I'm kind of just really wanting nearly to get to the capsule. This person, of course, had second, third capsulitis, or an intermetatarsal positive Mulder's click presentation. So by applying the needle kind of deeper into that area, you again increase their blood flow, and you are sustaining some form of a neurological, neurophysiological response, because it tends to improve. Next slide, please. So with low-level laser, I got into that after using acupuncture, because a lot of people are needle phobic. I feel the low-level laser acts a bit differently. It's particularly, I find it useful when there is pain, and you can just, the low-level laser, there's lots of different types. The one that I use, it's portable, it's a probe. It looks very like a Doppler, handheld Doppler probe. It's and it is very good for targeting local pain. So somebody had, again, you could do it in that case, a show before of a capsulitis, or on a trigger point where the pain was, the person didn't like, or on children and they were needle phobic, you could use it in those areas as well. Next slide, please. So to kind of demonstrate further in kind of a real life setting, I've selected two case studies. So the first case study is the boomerang case study. Do one, sorry. Okay, I'll do the next one because it's actually faster. Oh, sorry, I need you to go to that one, yeah. So this guy is plantar heel pain. You all see it. He'd been to see a physiotherapist and had the plantar fascial issues had resolved, but he still had pain around the medial aspect of his heel. So I palpated his abductor hallucis. I could feel a really good trigger point there. So I was delighted with my needle, I inserted it in. And he was, at this point, not sure about podiatry, thought physios were the people to do all musculoskeletal and orthotics work. And so when I eased his trigger point, I then explained to him that the orthotic that he was wearing was actually irritating his abductor hallucis, because he had a really medially deviated foot type. So by releasing that trigger point, he was then confident to get custom orthotics from myself, because he knew that I was better able to help this condition. And of course, I put a medially deviated or Kirby skive and made sure he had a medial flange, housed his foot much better, and he was much more comfortable. And I think that is, sorry, next slide. So to sum up, acupuncture, low-level laser therapy are very accessible. The acupuncture needles are very cheap to use. Hopefully, I've demonstrated that they are a tool to evoke therapeutic change and allow for other modalities like exercise therapy or increased compliance with footwear or orthotics. And in also the short term, they reduce pain, and that makes their patients better. Thank you.
Thank you very much. Okay.